Of course, multiple or complex responses involving many organs, like the brain, nerves, the heart, lungs, kidneys, and spleen. All of these work together to maintain the body constancy. Constancy means the homeostasis, yani the state of the body in a stable state. The responses to injury are in general beneficial to the host and it can allow the healing and survival after trauma. What happened to the body during fasting, the metabolism? Usually normal healthy adult requires approximately 25 kilocalorie per kg per day, and these are derived from foodstuffs like the carbohydrates, lipids, and protein. This requirement of 25 kilocalorie can increase to 40 kilocalorie per day in severe stress states, like for example severe burn or severe trauma or multiple injured patient can need this amount of energy. In short-term fasting, and in fasting less than 5 days, the principal sources of fuel are derived from muscle protein and fat. الفات عادة هو يكون the most abundant source of energy. Normal adults contain 300 to 400 grams of carbohydrates in the form of glycogen. هذا glycogen هو راح يكون source of fuel in the short-term status, and after the attack of burn or trauma. This glycogen, 75 to 100 grams of which are stored in the liver. And this amount, 75 to 100 grams of glycogen, will go rapid metabolism after trauma or sepsis, and the shift to the other part of the glycogen, which is 200 to 250 grams, stored in the skeletal muscles and the smooth muscles and the cardiac cells as well. It is important to recognize that the response to injury is graded, which means that the more severe the injury, the more severe or the greater the response. This is not only applies to physiological or metabolic changes, but also to immunological changes. فإذا it involves the physiology, metabolism, and immunological status sequence. Following elective surgery, for example, a hernia surgery or cholecystectomy, for example, there may be transient and modest rise in temperature, heart rate, respiratory rate, energy expenditure, and peripheral white cell count. I will see that there is transient and modest rise in these inflammatory markers and vital signs like temperature, heart rate, respiratory rate, and also the peripheral white blood cell count. It means that there is an increase in the leukocyte count in the circulation after trauma and after elective surgery. In case of major trauma of sepsis, these changes are accentuated. It means that there is more increase in the temperature, more increase in heart rate, respiratory rate, the energy spent during the attack, and the peripheral white cell count also can be decreased more. The changes in major trauma resulting in a condition known as SIRS, اللي هو Systemic Inflammatory Response Syndrome, اللي هو characterized by hyper or hypothermia, increase or decrease in the leukocyte count, can demonstrate this syndrome, اللي هو Systemic Inflammatory Response Syndrome. Also, it can causing marked catabolism, shock, and even MODS. MODS هنا معنى multiple organ dysfunction syndrome. Multiple organ dysfunction syndrome. What are the mediators of the metabolic response to injury? The mediators عادة can be described by neuroendocrine response and metabolic response. Neuroendocrine pathway of the stress response consists of the efferent nociceptive neurons. اللي هي at the site of a trauma or surgery, there will be stimulation of the nociceptive fibers or nociceptive receptors. And these nociceptive receptors will transmit the impulse toward the spinal cord, and then the spinal cord toward the thalamus and hypothalamus, and to the pituitary gland to secrete the hormones. What is the natural response to injury? If you get an injury, what is the natural responses that you may feel? One of them is the immobility and rest. You may see one patient with a fracture, for example, of the limb. He tried to rest the limb, not to move it, so as not to provoke the pain sensation. And one of the natural responses here, rest and immobility. Anorexia is one also of the natural responses to the trauma and injury. What do we mean by anorexia? Yes. Loss of appetite. It is loss of appetite. And catabolism. Catabolism, it means that there is breakdown of large molecules of energy into smaller ones so that the body can use it in the energy expenditure. To reduce the sensation of the pain, it is one of the natural responses. And if you get trauma to the finger, to the hand, you try to immobilize it so as not to provoke the pain sensation. A term used in the metabolic and endocrine responses to injury هو يسموه ebb and flow phases. يعني مثل المد والجزر. سامعين بالمد والجزر بالبحر مد وجزر. فهذه أيضا ال ebb and flow phases applied to the responses to injury. The ebb phase begins at the time of injury and lasts about 24 to 48 hours. It can be attenuated by proper resuscitation. يعني patient with multiple trauma can have this flow of neuroendocrine hormones. We can attenuate it. يعني نقدر نقلله by proper resuscitation. Proper resuscitation معناته we give IV fluid to the patient, we relieve the pain by analgesia and combat the infection. The ebb phase is characterized by hypovolemia and decrease in the blood volume. Hypovolemia, decreased basal metabolic rate, and basal metabolic rate also will be decreased. Reduced cardiac output, hypothermia, and lactic acidosis. All of these are characteristics of the ebb phase. Predominant hormones regulating the ebb phase are catecholamines, cortisol, and aldosterone. These hormones are released from different sites. Catecholamines usually released from the sympathetic neurons and from the adrenal medulla. And the cortisol secreted and aldosterone from the cortisol from the adrenal cortex, secreted from the adrenal cortex.
دكتور وهذا الفيس الأول بتصير هايبوثيرميا لما يكون الإنسان بداية الإنجري ليش مو هايبر؟
Because of loss of blood volume. يعني خلوا الأسئلة مالتكم إذا سجلوها بالأخير نتناقش. The magnitude of this neuroendocrine response depend on the degree of blood loss and stimulation of the somatic afferent nerves at the site of injury. اللي سميناها nociceptive nerve fibers. Once get stimulated, the magnitude of neuroendocrine response will depend on it. Following this resuscitation, the F phase evolved into a flow phase, a hypermetabolic flow phase, which corresponds to the systemic inflammatory response syndrome. اللي وراه يصير عندنا ال SIRS. This phase involved the mobilization of body energy stores for recovery and repair, and the subsequent replacement of lost or damaged tissue. وراه يسوي mobilization of the energy stores from the fat, protein, and carbohydrates lead to replacement of the damaged tissue. Characterized by tissue edema, an increase in the fluids in the tissues, an increased VMR, increased cardiac output, raised body temperature, leukocytosis, an increased oxygen consumption, and an increased gluconeogenesis. Now, gluconeogenesis, if you take in the in the chemistry, biochemistry, gluconeo, it means that formation of glucose from non-carbohydrate sources, and from protein or from fat, and so gluconeogenesis. At the time of injury, we say that there is F phase, flow phase, and recovery. The F phase can be or can occur within hours after trauma and characterized by shock status. Shock status and all the signs and symptoms of shock status can occur in this phase. The flow phase can follow for 4 days or last 4 days and characterized by catabolism. And the recovery phase اللي هو يكون عندنا last 4 weeks, and this can result in anabolism, يعني loss, replacement of lost or damaged tissues. During the catabolic phase or the flow phase, the increased production of counter-regulatory hormones, as we said, include catecholamines, cortisol, and glucagon, and inflammatory cytokines. Inflammatory cytokines released by which cells? Yes, immune cells, اللي هي macrophages. Interleukin 1, interleukin 6, and tumor necrosis factor alpha. These, along with the hormones, will result in significant fat and protein mobilization, and can lead to loss of the weight because of an increased urine nitrogen excretion. And there will be loss of the skeletal muscle. Question after the lecture. Sajla after my question. An increase in insulin at this time is associated with an increase in the insulin resistance. من يصير insulin resistance راح يصير عندنا a hyperglycemic like status. يعني patient behave or the body behave like in diabetes mellitus. يعني hyperglycemic status. And this can lead to complications, particularly infectious and cardiovascular. What is the purpose of these changes following injury? To provide essential substrates for survival. يعني ينطينا from catabolism راح ينطينا substrates for the other functions of the immune system, and postpone anabolism. يعني anabolism راح يكون عندنا بال following phases, and it optimize the host defense. يعني يقوي host defense. These changes may be helpful in the short term, but can be harmful in the long term. Here the body in response to the injury will reprioritize the limited resources. يعني resources راح diverted away from the muscles and other cells into the most important viscera, يعني key viscera يسموها liver, heart, renal system, and the immune system and the wound itself. راح يصير shift of the metabolites or resources from the peripheral tissues into the most important organs like the liver and the heart and the immune system. Majority of trauma patients, except those with extensive burn, demonstrate energy expenditure 15 to 25% above the healthy resting values. يعني يكون قلنا above the normal or normal healthy status. This energy expenditure can be reduced by the standard intensive care, include bed rest or place the patient on ventilatory machine. يعني نسوي عندهم on mechanical ventilation and external temperature regulation to prevent hypothermia. Skeletal muscle wasting experienced by patients actually limits the volume of metabolically active tissue. يعني يصير عندهم muscle wasting أكثر. Decrease in muscle protein synthesis is also play a part in the wasting of the muscles. And this is observed in all muscles except the cardiac muscle. Cardiac muscle usually is the spare of this waste. SLB has waste. Under extreme conditions in major sepsis, the urine nitrogen loss may reach 14 to 20 grams per day. And this amount will equal to 500 grams of the skeletal muscle. شنو الفيتشرز اللي راح نشوفها على المريض with muscle wasting؟ asthenia, increased fatigue, decreased functional ability, decreased quality of life, and increased risk of morbidity and mortality. الأسئلة بعد المحاضرة. Loss of urine nitrogen؟ أي بعد المحاضرة. أيضا قلنا إنه increase the interleukins secreted by inflammatory أو mononuclear cells that secrete the inflammatory mediators. These cytokines, the interleukin 1-6 and tumor necrosis factor, promote the hepatic synthesis of يسموها acute phase proteins. شنو الacute phase proteins؟ C-reactive protein, C-reactive protein, and fibrinogen. هذول acute phase reactants or proteins, fibrinogen and C-reactive protein. Albumin fall acutely following the injury, and patient will experience hypoalbuminemic state. Insulin resistance, post-operative hyperglycemia develop as a result of an increased glucose production. Now, عندنا صار increased glucose production, and in the opposite, there is resistance of the cells for insulin, and this can limit the glucose that enter the cells and produce a status of hyperglycemia. Also, this resistance to insulin is proportional to the magnitude of the injury. يعني whenever there is an increase in the injury magnitude, there will be an increase in the insulin resistance. So the patient with insulin resistance behave in similar manner to individuals with type 2 diabetes. A type 2 diabetes and hyperglycemia and post-operatively or post-traumatic will be the same for glucose. This will increase complications like risk of death, sepsis, deteriorating renal function, polyneuropathy, and the patient may die from the hyperglycemia. Usually normal adult or human ingests 70 to 100 gram protein per day, which is metabolized and excreted in urine as ammonia and urine. Following injury or major injury, there is continuing urinary nitrogen loss. That's all? سؤال عندك؟ فشوف after the trauma or injury there is continuous loss of this nitrogen, and we say it is equal 500 gram of weight lean body mass. يعني راح يفقد المريض per day in severe status, in severe burn or sepsis. Unless it is corrected, the patient will get wasting of the muscles and the patient will lose his weight. The body weight عادة increase or resuscitation with expansion of extracellular fluid by 6 to 10 liters within 24 hours from resuscitation. After that, the total body protein diminished by 15% in the next 10 days, and the body weight will reach negative balance. How we can block this neuroendocrine stress response? By using analgesia. And a patient after trauma or major injury, we can give him analgesia to reduce this neuroendocrine response. Also provide early enteral feeding, some more parenteral nutrition. Or enteral feeding. Enteral feeding through the normal pathway, or parenteral feeding by placement intravenous nutrition fluids to give to the patient, or by enteral feeding. Enteral feeding by placement of a tube, like for example nasogastric tube or jejunal tube, and give them food through this tube. Enteral feeding will reduce the complications encountered with the patient. And excessive administration of IV saline should be avoided. What can exacerbate this stress response? Exacerbated ممكن by anesthesia, يعني anesthetic medications can increase the metabolic stress response. Dehydration also is one of the exacerbating factors. We can overcome it by optimum resuscitation and through the fluids. Starvation يعني نخلي المريض preoperatively fasting for prolonged hours can also exacerbate the stress response. Sepsis, acute medical illness, or even severe psychological stress, all these can exacerbate this response. What are the avoidable factors that compound the response to injury? Continuing hemorrhage is one of the avoidable factors. We can stop bleeding whenever we see it. And إذا كان external bleeding or internal bleeding, we can manage it by stopping this hemorrhage. Hypothermia, especially in the severely injured patients, you should avoid hypothermia. يعني another meaning, you should cover the patient with the blankets and examine the patient in the warm room حتى نقلل الريسك of hypothermia. Hypothermia results in an increased elaboration of adrenal steroids and catecholamines, and this can be harmful for the host. It also results in 2 to 3 folds increase in cardiac arrhythmias and increased catabolism. But these are the effects of hypothermia, so as we need to prevent the hypothermia so as not to have these harmful effects on the patient. خاصة cardiac arrhythmias is very important complication of hypothermia. Tissue edema is also one of the avoidable factors, and tissue under perfusion, starvation, and immobility can all avoidable factors. How to prevent the unnecessary aspect of the surgical stress response? Shandij? سؤال? How to prevent the unnecessary aspect of the surgical stress response? By using different methods. One of them is the minimal access techniques. And one of them is by endoscopic treatment or by laparoscopic management. يسموها minimal access, يعني أقل size of wounds can be applied to the patient. يعني كل ما يقل حجم الجرح كل ما يقل effect of the stress response. Block of afferent painful stimuli. يعني قلنا احنا هذا nociceptive receptors, once stimulated, this will cause the stress response to be augmented. But we need to block these afferent nerve stimuli. Minimal periods of starvation. كل ما تقل فترة starvation before surgery or after surgery or after trauma, the surgical stress response will be reduced. And early mobilization is important here in the, for example, development of deep venous thrombosis, for example. Deep vein thrombosis, one of the complications that may follow any severe trauma or severe injury. Why? Because of reduced mobility. Patient not move, always bedridden, and can develop stasis of the blood in the deep veins and result in deep venous thrombosis. Early mobilization is a very important prophylactic measure against the development of unnecessary aspect of surgical stress response. وقعدنا هذا الفيجر اللي هو يوضح لنا ال stimulation by the here at the time the area of injury or nociceptive receptors, and will transmit into the hypothalamus through the spinal cord. The afferent nociceptive pathway to the spinal cord and then to the brain, to the hypothalamus. The hypothalamus will stimulate the pituitary gland to secrete the corticotropin releasing factor اللي هو CRF موجود بالhypothalamus, and will stimulate the pituitary gland to secrete the hormones. One of the hormones secreted by pituitary هو ACTH. ACTH will increase, and the growth hormone in the plasma will increase both the ACTH and the growth hormone. This will lead to adipocyte and lipolysis. And the ACTH growth hormone will lead to lipolysis, يعني release of the uh, materials from the fat cells. Also, the ACTH will stimulate the adrenal gland, adrenal cortex, and adrenal. The adrenal cortex will release the cortisol. Sympathetic nerves will affect the adrenal medulla and lead to release of adrenaline اللي هو بالاسم الآخر الكاتيكولامينز that will be secreted. شو يسوون هذول adrenaline and cortisol will increase the hepatic gluconeogenesis. يعني form glucose from non-carbohydrate material. Pancreas also is one of the stimulated organ. راح يفرز لنا منه glucagon. Glucagon will increase in the blood, and this will lead to glucogenesis and glucogenolysis. كلها تسوي لنا جلوكوز باي glucagon اللي هو هذا اللي راح يزيد الجلوكوز in the circulation. Yes. This neuroendocrine response will act with the immune system to stimulate the قلنا اللي هي mononuclear cells to release the inflammatory markers or inflammatory cytokines, interleukin 1, tumor necrosis factor. These can cause pyrexia, and pyrexia felt by the patient after trauma or operation is attributed to these cytokine release or inflammatory markers that can cause pyrexia. On the other hand, there will be decrease in the insulin growth factor, or insulin growth factor 1, and testosterone and T3. These are decreased in the circulation, and after an decrease of these hormones, the counter-regulatory hormones can cause an increase in hypermetabolism. من عنده سؤال؟
The endocrine system is secreted corticosteroid. We know the corticosteroid is the active anti-inflammatory. Don't go to the liver. For example, the glucagon going to the liver to form the gluconeogenesis, but the corticosteroid not going to the liver to stimulate the glucogenesis.
It's called lipolysis.
Corticosteroid only causes the relieve the symptoms of the patient. Example of fever.
Cortisol
is the anti-inflammatory.
Cortisol increase the hepatic gluconeogenesis. Cortisol.
I know the anti-inflammatory because they're relieving the symptoms of the patient. And you
هنا راح increase to a maximum amount after trauma and surgery. Will cause يعني harmful effect, not an inflammatory action.
and
It acts with other hormones. يعني هو الجلوكاجون هنا هو المهم للcounter regulatory hormones.
yes, glucagon is the going to the liver and
Yes.
forms the gluconeogenesis, but the corticosteroid, I don't know. And the second question, insulin, when you decrease in the body, natural, the glucose in the bloodstream is very high. Why this the glucagon with the insulin same time?
Glucagon increase.
Yes, glucagon.
Insulin is
but-
decreased in the start
yes.
of the condition. Although it will be increased in the second hand, but there is insulin receptor resistance. يعني ما يخلي glucose يدخل للسيلز. راح يصير status of hyperglycemia.
Yes, I know that, but insulin in the bloodstream is the high because not enter to the
Because of
because
resistance.
have the resistance from the cell.
The
Inside
glucose-
the cell decrease or bloodstream. Oh.
It increase in the bloodstream glucose increase in the bloodstream. يعني هو الانسولين فايت يدخل الجلوكوز from intravascular to cellular
Yes.
to the cell. حتى حتى يقل عند بلاد لازم الانسولين يدخله الى فهي الستيت اوف هايبرجلايسيميا احنا اكزامنت اللي يعني اللي فاسكولار انترا فاسكولار نوت انترا سيلولار وي اكزامن ذا جلوكوز. منو بعد عنده سؤال؟ ما ادري ايش هذا السؤال. عبرنا؟
دكتور سلايد 11.
muscle wasting
دكتور هو أول
يعني اول باراجراف لو ثاني باراجراف. قلنا يصير muscle wasting as a result of an increase in muscle protein degradation. شنو المفهوم؟ Decrease muscle protein synthesis and an increase in protein degradation can result in muscle wasting. Only cardiac muscle is spare يعني ما راح يصير بها wasting. ماشي.
دكتور بايركسيا
بايركسيا شو بيها؟
معناه
فيفر فيفر. هنا ليش يصير muscle protein يعني loss of muscle proteins because of an increase in urinary nitrogen loss. كل ما يزيد urinary nitrogen loss كل ما المسل ماس تقل حجم المسل ماس due to degradation of this protein in the muscle. لا هي because of this stress response راح يصير degradation of the skeletal muscles and the smooth muscles. This will elaborate nitrogen. Nitrogen will be increased in the urine يعني راح يطلع باليورين. زين؟
This condition is occur in the older patients.
إذا كانت prolonged trauma
Yes.
Hey.
The prolonged is a
قلنا ده severe sepsis, severe trauma,
Yes.
severe burn هذول اللي bedridden in the intensive care units for prolonged periods يعني days, weeks, مرات months يكون by intensive care units.
Because they need the protein to form the connectivity.
Protein will build the body mass يعني muscle mass كان build the muscle mass. منو عنده سؤال هنا؟ منو كان نايم؟ ما حد نايم؟
دكتور هو يعني وصف إنجليزي أسوأ resistance
نعم.
وصف إنجليزي أسوأ resistance and duration يعني
اي
يعني
هو هذا one of the responses to trauma يعني تصير cells resistant to insulin. فالجلوكوز يبقى عنده circulation ما يدخل للسيلز. فاهمين شلون؟ فمن تفحصين تسحبين دم تلقي هايبرجلايسيميا راح يصير. وهذه الهايبرجلايسيميا will increase complications. Increase infectious process. It has an impact on the heart. Even the wound will be affected by the hyperglycemia. An increased infection of the wound. اي مثل رمضان احنا من نصوم رمضان هو هذا شورت تيرم فاستنج.
بس احنا يعني ويعملها نهائيا
اي سؤال؟ انت اللي كنت كلش مركز ابو النظاره. ايش عندك سؤال شيء؟ عاش ايدك. من عنده سؤال؟ اكو احد سجل اسم واحد ما حاضر؟ اعترفوا. اوكي ثانك يو.